color there. Ah, okay. This meeting is being recorded. And for anybody who cares about what's going on in Washington County, you probably already know Washington County is the most diverse county of all 36 counties in the state of Oregon, with fully a third of its people being people of color. We care a lot about that, but mainly because we know at the coalition that if you have housing in your life and a stable home and a roof over your head, everything is better. So some of our past work includes our Leading with Race report, which came out in 2018, and that has some housing information in there. 2019, we did a housing justice report in Washington County with the cities of Beaverton and Hillsborough, and they were very instrumental in helping us do that. And even in 2020, we worked with Washington County Thrives on a report looking at the whole continuum of services from housing to homelessness to transitional services to where the police fit in public safety, to where the hospitals and clinics and resources and mental health and addiction services. So there's a lot going on in Washington County about housing. And we just believe that the opportunities that are coming up from the county, this is, I think it's the last thing I'll say is, I guess it's just important that you realize the county has started a new process in the last, call it 3 to 5 years of outreaching to community. They did it with their community listening sessions. They did it with their information about trying to find out what the community thought about body-worn cameras. They have a new chief equity and inclusion officer there and a whole department, including part of what we're going to talk about today. They have a specific person designated for supplier diversity to try to get various contractors into the county. So I'm excited about what's coming. I look forward to the discussion today, and I hope that you all are brutally candid with the county staff and the county commission about what you need to be successful and how you as community members can work with the county to make it a better place for housing and for everything else. So I think I'm done talking now, and I'm going to introduce the chair of Washington County's Board of Commissioners, Catherine Harrington. I'll just leave it at that. Catherine Harrington has been the board chair for about 2 years. I've enjoyed my time working with her, but I will let Chair Harrington take it from here. Welcome.
Thank you, Marcus. And I have been working as a colleague with Marcus Mundy since I was an elected Metro councilor at Metro, your regional government. Since the Metro Council spent over 5 years developing, and then finally in June of 2016, adopting a strategy to advance racial equity. I have carried all of those learnings and more here in my role as the elected chair of your 5-member Washington County Board of Commission, as 3 of us started as new members in January of 2019, which was quite a sea change for the elected Board of Commissioners. With that, and also with the help of the Coalition of Communities of Color and many of your organizations, our county board adopted an equity resolution in February of 2020. Marcus touched on some of the changes that we instituted in 2019 in our first year together, and we continue to advance our policies and practices even further, particularly under the watchful eyes and coaching of our Chief Equity and Inclusion Officer, Latricia Tillman. We have great staff at Washington County who are helping us do our work on behalf of the community better and better. I want to give you all a heartfelt, sincere welcome to this forum today to help us shape that request for qualifications proposal, that RFQ, so to speak, in government speak. I also want to give a huge thank you to the Metro Council, including Juan Carlos Gonzalez, Metro Councilor for the northern portion of Washington County, and Garrett Rosenthal, the central and southerly portion, Council President Lynn Peterson, and all members of the Metro Council, past and present, who have done the hard work to go to the voters in order to ask the voters to support both the affordable housing bond measure of November 2018, as well as the supportive housing services funding measure just recently in May of 2022. Our Washington County team, I'm very prideful of them. They're an awesome team. They've been working hard, gathering community input so that our first ever local implementation plan for the supportive housing services program meets the needs and exceeds the needs. That document outlines ambitious yet achievable goals. This forum is a way for you to push us to make sure that we're putting the support in place so that you as service providers can help ensure that we are all succeeding together in delivering these services. So hopefully I haven't taken too much of your very valuable time so that you can get to the breakout groups and so forth to capture your input and feedback. Thank you very much for everything that you do each and every day. You motivate me to do better and better work in my job. Thank you.
Thank you. Thank you, Chair Harrington. And I want everybody on the call, you heard the chair say, to push her and to push the county. So make sure that you do, and let's have a very candid conversation. I'm just going to take a moment here to talk about the goals of the meeting, which is be very brief. The goals of the meeting are to ask lots and lots of questions, find out what you need to be successful, what you need to do to get your questions answered, so you will have access to county services and county contracting. And then I also wanted to share just a little bit with you about the agenda. You know, the 3 questions up here on the page right now are what we're going to do. We're going to have a breakout room. The agenda is basically you're going to hear from some key county personnel, and they're going to talk about the supporting houses overview. They're going to talk about the request for programmatic qualifications process itself. You might hear some early survey results from these same questions. But then the key part, the most important part, is for us to get to the breakout sessions and have those discussions. So you all can read, but how would you describe the services your organization hopes to provide in the county? What do you need to be successful in making the application? And what support, whether that's technical services or anything else, does your organization need to be successful as an ongoing service provider in Washington County? Because the other thing about this, Washington County doesn't just want you to apply for this one opportunity. They want to create a relationship with community so that the county and community are always working together for the residents. So with that, I think I saw Latricia Tillman join the call, and I just wanted to give Latricia a chance to see if she had anything to add to what the chair had said before we pass it on to Josh and Jess and the rest of the team.
Sure, and thank you, Marcus, for giving me a couple of moments to share. I do want to start by thanking very much the community engagement team within the Office of Equity, Inclusion, and Community Engagement for helping to build a bridge and a two-way communication pathway between our diverse community partners and our county service delivery, both in housing, but also with our electeds and our countywide system. We are very excited and appreciative again of Metro for centering and the community partners who brought us the supportive housing services measure for centering equity and community engagement, and just want to reiterate our commitment to centering the experiences of communities that government has historically marginalized in the area of housing and health and human services across and other disciplines as well. We want to rebuild the trust and the relationship with diverse communities who are experiencing chronic houselessness and housing instability. And I am very proud to be partnering with the team that is moving supportive housing services forward within our housing department within Washington County. They have demonstrated an incredible commitment to maintaining equity and centering community in the ways that we advance supportive housing in Washington County, and to making sure that our strategies align regionally so that communities that are experiencing vulnerability, that aren't familiar with county lines, don't care about jurisdictional boundaries, don't experience additional barriers because they aren't aware of those distinctions, and want to access culturally affirming and culturally responsive, culturally supportive services. So as the chair mentioned, we are very interested in your candid stories, your recommendations, your constructive criticism, so that we can take full advantage of this opportunity and build a housing system that is going to be fair, equitable, and effective for all Washington County residents. So thank you so much for being here. We are very excited to build this relationship. This is not a one and done. And we look forward to continuing to work with you in partnership going forward.
All right. Thank you, Latricia. And, I particularly like the point about crossing the boundary lines. I think the Metro councilors, including Washington County's councilor, Juan Carlos Gonzalez, they worked hard to make sure that it was a systems approach. So I look forward to see what's going to come out of that. Without further ado, though, and if it's okay with you, Ty, I'd like to ask Josh to start talking about supportive housing services.
Thanks, Marcus. I'm so excited to be here with everyone today. My name is Josh Kreitz. I'm the Assistant Director of the Housing Department. I use he, his, him pronouns. And I'm going to get into it really quickly here, but I just want to say how excited I am right now. There's such alignment between the board, our county administration, and the staff and all the departments around just really centering equity, transparency, and accountability in this measure. So it's really exciting to be sitting here with everyone today and to have the opportunity to talk about this. I'm going to go ahead and ask Ty to move it to the next slide. So I'm just going to give a quick overview before I turn it over to my colleague, Jess Larson. So the SHS measure itself was approved by voters back last year with 58% support. It was built and championed by a broad regional coalition of businesses and community leaders. And again, what's really exciting about this measure, and we talk about this quite a bit, we believe this is scaled to end chronic homelessness regionally here throughout the Tri-County region. We said this a few days ago, but this is the largest per capita investment to address homelessness in the nation. I had conversations quite a bit with colleagues who do this work across the country, and really large cities like LA, where maybe 700-800 million is going into it. But this measure itself is larger per capita than anything else out there. So we're excited about the scale of this. Next slide, please. Just a little bit on the revenue, because that's important. That's what's going to fund us here. It's funded by two taxes: a 1% tax on taxable income of more than $125,000 for individuals and $200,000 for couples filing jointly. And then the second tax is a 1% tax on profits from businesses with gross receipts of more than $5 million. If you're asking, what does that actually mean in dollars and cents? Regionally, we expect this to scale up to more than $200 million a year for homeless prevention and services and housing. Here in Washington County, that looks like $38 million in year one. That's significant. That's significant if you consider the investment by HUD right now in homelessness in Washington County is $4 million with COC dollars. So that's a significant increase. And we expect that to scale upwards of $75 million by year three. Next slide, please. And just to give a little bit of a level set on prioritizing the communities in need. Individuals, people with disabilities experiencing or at risk of prolonged homelessness and with extremely low incomes are being referred to as priority population A. So those really chronically homeless individuals and families. People experiencing episodic homelessness or risk of homelessness are being categorized as priority population B within the actual metro measure. And then again, this measure is really designed to lead with race, with Black, Indigenous, and people of color, BIPOC communities are being disproportionately impacted. Next slide, please. I want to go ahead and turn it over to my colleague, Jess Larson, who's going to go a little bit more into the details around this RFPQ. Thanks.
Thank you, Josh. And thank you everyone for being here. Thank you for the opening remarks. It's just lots of good energy in the room, even though virtually. Happy Friday to everyone. My name is Jess Larson. I use she and her pronouns, and I'm new to the Washington County Department of Housing Services team and excited to be working with you all here as we build out this incredible new program, the Supportive Housing Services Program. So my job today is to give you a brief and high-level view of what this RFPQ process will look like. It is not, we don't want this is not the full presentation of the RFPQ. And our goal is not to have a conversation about the technical aspects of the application process, but to give you a sense of what's coming. And the reason for having this conversation is to hear from you all up front as potential and future service provider partners, what it takes for you to deliver the kinds of services you deliver or to expand upon the kinds of services you want to be able to deliver through this new program, and how we can improve upon the structures, the procurement structures that are necessary in order to engage in those future contractual relationships between the county and yourselves. So my job is to just kind of paint a broad brush picture of this procurement process that's coming, so you have a sense of the context. But then really our conversation and our goal of the discussion today is to understand your desires as service provider partners and the challenges you've experienced in contractual relationships with government entities in the past, including ourselves, and how we can improve upon both those structures and the ongoing needs of your organization to be successful in the work you want to do here in helping us to reach functional zero and chronic homelessness. Okay, so RFPQ stands for Request for Programmatic Qualifications. And this is the procurement process we expect to be rolling out sometime in the month of April, probably mid-April, and it'll probably be open for approximately a month, so closing sometime in mid-May. The goal of an RFPQ is to qualify a pool of potential service providers. So this is not the bidding process. This is not the project proposal process. This is a process for making organizational entities qualified to enter into potential contractual relationships in the future as service providers. The service allocations, that is the step that would come after the RFPQ approval process or qualification process rather. So those service allocations for the particular service areas, which I'm going to get into in just a second, that will come after we've reviewed all of the interested organizational partners and qualified that pool of the future service provider network. I'm sorry, I didn't finish the last slide. And maybe I need to move on a little bit faster, so I will. The anticipated allocation for this, as we get started, when we get to that allocation period, we're expecting to allocate about almost as much as $20 million in the first year. So we want to just be very upfront. Like there's a lot of resource going out through our future service providers. And so we're hoping, again, to bring in a very broad network of qualified partners to do that work with us. The other important detail we want you to be aware of as you consider this application process is that our expectation is this qualification process will last for 3 years. So through the fiscal year 24-25. So that's another reason we're really working to get the word out and encourage any potential organization to come through this RFPQ process with us. And then last, it is also possible that Clackamas and or Multnomah counties would choose to engage in contracts with qualified partners who come through the RFPQ process with Washington County. So there's a bit of a reciprocity, a mutual relationship there. I sorry, I lost that word as I was trying to say it. That will allow the contractual relationship to extend to the other 3 counties in our tri-county partnership. So lots of good reasons to prepare for and hopefully join us in this RFPQ process. Okay, next slide. I think this is too much you really have to lean in to read this slide, but the point here is to demonstrate how significantly we are expanding services, both in dollars, but also in the types of services that are currently provided. So in the left half of the document, you can see the continuum of care column, and that describes the number of households who are being served and the dollars for the different kinds of services that are going out the door right now, or this was 2 years ago, but it's much the same here in the 2020 fiscal year. Approximately 1,100 households have been served with approximately $12 million. And that's not just our funding from the Department of Housing Services. That includes a lot of match funding from many of you, the service providers. But that's our current capacity and the current impact. We're expecting to add, as Josh mentioned, a $38 million in additional SHS capacity for an additional 1,800 households that can be served with the supportive services investments. That's the middle column. And then on the far right, you see the 2 added together. But the other important item of note here is that the bottom 2, well, the 2 new rows on the far left describe services and investments that aren't currently being made that are going to be added because of the capacity and the strategic investments of the supportive housing services system that we're building. So outreach workers, housing navigator workers, the supportive services, the wraparound care that helps keep people in housing, the retention workers that help keep people in housing. We're going to go through this in more detail, but a lot of that work is just simply not able to be funded with our current continuum of care investments. And so that is going to be a significant component of scaling up what we do right now as a Department of Housing Services in our homelessness and supportive housing programs. And then the second new row at the bottom there is around system capacity building. So investments being made, especially into culturally specific and emerging service provider organizations so that you are capable and able to deliver the quality of care and the services that you want to deliver in the community you're already working in. So capacity building in our organizations will be a component of the investments that we can make through SHS.
Jess,
Yes.
I'm going to request in the chat to slow down a little bit in this portion of the presentation. It is, as a reminder, it is being simultaneously interpreted as well. And then there's also a question in the chat. Are Multco and Multnomah County and Clackamas County doing an RFPQ process too, or is it just Washington County?
Thank you for that clarifying question. And Ty, you would like me to slow down as well?
Yes.
Okay, thank you.
Is requested.
Okay. Yes. Yes and no. So with the question around RFPQ processes in the other 2 counties, at this time, my understanding is Multnomah County has already conducted extensive RFPQ processes for their they have, I think, 4 different continuum of care. I don't know exactly the right way to describe this, but they have already pools of qualified service providers that they will be drawing from to expand upon and create new services through the SHS program. However, they might find it advantageous and necessary to also reach across the county lines and partner with providers who've applied for this RFPQ that aren't included in their existing RFPQ. But in Clackamas County, they are in a similar position to us here in Washington County, where we don't have an existing pool of a broad enough pool of service providers. So they also expect to be doing an RFPQ process. I don't have the specifics on the timeline or the structure of that, but we are sharing information with each other to support each other's efforts. And I know that an RFPQ process is on their list of expected activities before the program is anticipated to begin in July. Okay, you're welcome, Melanie. Next slide, please. All right, so this is where I want to spend a tiny bit more of time in describing, and this has been included in the local implementation plan development. For some of you, this may look very familiar, but I think this is where we want to start to describe the kinds of services that we are expecting to invest in through supportive housing services, and we hope that you will be considering providing as our future supportive housing services providers. So we have here 5 different areas that will be included in the scope of work as it's described section of the RFPQ. And these are big buckets of service areas. They are very inclusive. And also you may find as a service provider that your services work across bucketed areas. For example, perhaps you provide housing navigation services as part of your shelter program, for example. But nonetheless, we needed to create a sense of structure for the different kinds of services. And so these are the 5 different areas of services that we will be encouraging providers to apply for and describe how you would want to provide these services. So the first being outreach and engagement work, going out into our communities, connecting with people experiencing homelessness and housing stability, and helping them connect to the supports, the housing services, the shelter services, the basic needs services, whatever the case may be, to help them connect to the care and the plan that's going to help them achieve housing stability. The next bucket is shelter and transitional housing. We've put these 2 together to be very flexible and almost like it's a continuum of services that can look like a lot of different things. This can include alternative shelter strategies. It can include non-congregate and congregate shelter strategies. So it's an open-ended bucket of service provision that generally is a time-based non-permanent housing solution for someone while they are working on their permanent housing plan within the system with housing navigators and otherwise. Which brings us to the 3rd bucket, housing navigation, housing placement, and eviction prevention or homeless prevention services. So these are the tools and the caseworkers in our community who help people to navigate whatever it takes to get back into housing or to manage challenges, unpaid rent or whatever it takes to keep them in housing. The housing services associated with getting to housing, those barrier buster funds, case managers who help people get IDs and their documentations in order, case managers that help people apply for wait lists, all of the work of helping people ultimately get to that housing placement. And the next 2 buckets I'm going to spend some time describing because oftentimes they are thought about as that's right, pay debt, get references, etc. Thank you, Katrina. I see some of the chats pop up as I'm talking here. So the next 2 buckets are related but separated for the sake of this process. They relate to what we often call as supportive housing services. So there's we're distinguishing between the housing stabilization services. Often these are the housing-based services like the resident services coordinators, the retention workers, the staff and operations in supportive housing buildings to make sure that there's enough support on site for tenants with higher needs. And then the wraparound services or supports, which include the community-based behavioral health workers, the employment service programs that help people achieve employment stability or get back on track with training and other opportunities towards to improve their income. And disability benefits, advocacy, and other legal support. So general wraparound services, whatever it takes for someone to be safe, stable, and healthy in our community, but these supports not necessarily tied to the housing stabilization specifically, if you will. So I think the next two slides describe that a little bit more in detail. So if we could advance. Here are some of those housing stabilization services, the housing retention workers, the resident services, the building operations that I mentioned. And then the next slide, again, some of those wraparound services, physical and behavioral health services, the peer support specialists, education, training, and employment services, benefits, and legal services. All right, so you can see those two buckets, and really we're trying to paint a big picture of all of the services we're hoping to recruit into this RFPQ process. This slide, though, is a couple of the items that aren't going to be a part of this RFPQ process. So long-term rent assistance, the voucher program that will help people permanently afford their rents. This will be administered through our housing authority colleagues, our rent assistance team. So we won't be seeking service providers for that. We'll be using our Washington County staff, but we will, of course, be making those vouchers available to the service providers who are providing all of the services. Technical assistance and training contracts. We already were partnered in an RFPQ process conducted by Multnomah County. So we don't need to recruit a pool of additional qualified partners for those technical assistance kinds of contracts with the county. We will be partnering with the results that came through the RFPQ process that the Joint Office convened just recently. Those capacity building investments that I described earlier, they are very, very much a part of the plan, but they won't be delivered through contracts or this RFPQ process. Those will be separate as a part of supporting our future partners who engage in contracts with the county. And then, of course, intergovernmental and intragovernmental partnerships and services are very much also on the table, but this is not the tool to execute those kinds of partnerships. This is the tool for procuring service provision with non-governmental entities. Next slide, please. So these are some of the things that will be included in the RFPQ application, just for your awareness. We'll be asking for organizations to describe how they currently serve or would intend to serve the priority populations of the measure, the program, how you plan to serve the entire county or which parts of the county you specialize in serving. Ensuring culturally responsive services. We'll want to make sure that all service providers are able to ensure a quality of care and their service provision that is culturally responsive for everyone who comes through the program. And then, of course, we will be seeking information from service providers who identify as or provide culturally specific services to describe those culturally specific services.
Yes,
We also
see a question from Christina.
I'm sorry,
Just
Hi,
read.
thank you. So one of my question is when serving different ethnic groups, normally Unite Oregon, we have served I think like 6 languages with rent assistance connection. But the need is so huge. We've been very lucky that City of Beaverton had helped us to help the bridge in interpretation for Beaverton residents. And we have something similar with City of Tiger. So I guess my question is, to me, there's a lot of immigrants and refugees that don't speak English, and we like if on the request for proposal, sometimes we put like up to 4 languages, but really that is not equitable, right? So we want to make sure that everyone that gets to us, regardless the language they speak, that if they got to Unite Oregon, that we're able to serve them. So is there a language line that the Washington County is going to let us use to be able to connect with those residents? Or what is the plan? Because like in a request for proposal, I know they're not going to let us put like 220 languages because we cannot measure, right? And getting paid for something that you might not do is another thing. So any ideas of like how to work around that to make sure that everyone, regardless the language they speak, we can serve and provide an interpreter?
This is an excellent question, Christina, and you're teeing us up for the breakout conversations that we want you all to engage in. I think this is you see that the bottom bullet here. This is we will be requesting applications consider your service delivery approach, but it won't be a specific proposal. Again, this is a process for qualifying service providers as an organization, not a specific proposal for a project or a bid for a specific contract. So this would be an excellent opportunity in the application to describe just what you've described, that you're an organization that provides services in whatever language it takes to be able to serve the community that you're serving. And so this is, it won't be an application that specifically limits any of that kind of consideration, but actually welcomes the broadest description of your approach to providing the services. But your question is a wonderful example of what it takes to be successful in providing the services you provide at Unite or many of our other organizational partners provide. So we encourage you to talk about those very things in those discussions. Okay, well, I'm going to move on because I feel like I'm behind our time and we need to help you get off to those discussions. Next slide, please. So here, this is the last slide, and this is just describing the next steps. So today is really just the beginning of this engagement and relationship building work we need to do, we want to do with you and the other service providers here in Washington County and those who want to come to Washington County. We're really just beginning this conversation and hoping to hear from you about the interests, the challenges, and the supports that you need to be successful as a future service provider partner as part of our qualified pool of contractors. So then with that information, we'll be able to finalize that draft of the RFPQ, understanding your needs and challenges and the opportunities, and release that sometime in April. Hopefully it'll be open for a full month so that we have plenty of time for Q&A sessions and other technical assistance to support organizations in making a very successful application to that process. More to come on when those events will be held, but just think of today's conversation as a first step, and more is definitely to come. And then ultimately, after the application process and then the selection process would come those allocation processes with the resources which we expect to have available in beginning July of 2021. So that's a sense of when we hope some of the programming will begin, but we also know it will take time to roll out all of this work over the first year of implementation. And all of this work includes a lot of that technical capacity building, training, all of these supports that you're going to help us discuss and define and identify today. So again, I'm just going to say it one more time. This is the first conversation, and we're so excited to be learning from you, hearing about your experience and expertise doing the work that you do, so that we can build stronger partnerships and deliver the best kind of care to our community. All right, I'm going to pass it back to the facilitators. Thanks, everyone.
All right. Then I think I think in my comments, I mentioned that the most important part of today was to hear from you all. So you've heard from staff and the technical pieces and the process pieces, but the most important thing we can learn from today is to hear the problems or the questions that you all have to surface. And then the county will also weave that in because they haven't fully baked the process yet. They want to hear from you first so they can make sure that what they put out is responsive to what they hear, both Wednesday, where we had one of these sessions, and today. So with that, I think I wanted to see the three, we're going to go into at least, what, 2 breakout rooms, Ty?
Yeah, 2 breakout rooms.
Okay, there's going to be 2 breakout rooms, and I'm sure it's going to be randomized, but there's going to be 2 breakout rooms. We're going to talk about the same 3 questions, which I think will be posted in each breakout room. We mentioned the questions earlier, but we'll either put them in the chat or have them on the screen when we go into the breakout rooms. And after this, we just want to hear from you, and then we're going to come back. We're going to spend about a half an hour doing that, roughly 10 minutes on each question. Then we're going to come back, hear report outs from each one of the 2 groups. And then I just want you to remember, this is your process. Yeah, it's the county's process. This is your process. I think everybody will have a chance to be heard, but if you do not, even if it's early on, please post your questions in the chat. So even if your question does not get answered today, the county can answer it, get back to you individually, or post it on the website. But the goal is to get all the questions answered and to hear from everybody on the call. So without further ado, how are we going to go through the breakout process, Ty?
So I'll ask that we go ahead and do our breakout rooms. We'll just break into, it looks like we have 47 participants. So if we could have roughly 23, 24 in each room, and that should happen shortly.
All right.
Okay, and just a heads up, I'm going to go ahead and open the rooms now. So folks will be automatically sorted into those. And then I'll also send a message to the breakout rooms when they're about to close to let folks know they have about a minute or so left.
Oh, and before we go, Highland, one quick thing. Whoever's facilitating in the breakout room I am not in, make sure that you identify a note taker. I mean, there might be some time updates, but someone to record the comments, and then whoever's going to report back out to the larger group, if you wouldn't mind. Thanks.
Okay, Marcus, we're all ready to begin. We've got about 25 folks in this room with you, and you're welcome to start the discussion, and I'm happy to note take for you.
All right. The one thing I would ask is either in the chat or on the screen, is there a way where we can have the 3 questions that the group is supposed to ruminate about?
I'll drop those in shortly.
Okay. But in the meantime, I thought I just saw one question already. Does the county have a detox center or a subacute mental health crisis center? And I don't know the answer to that. And so I would ask one of the county people on the call to either give the answer, or we will find that out for you.
Hey, Marcus, I know that we have the Hawthorne walk-in clinic, but I can get more details on the specifics of medical detox back to the group. Thanks.
Thank you. Thanks, Josh. And, oh, okay. Good. If you could blow that up just a little bit, and then I can.
Folks could raise their hand, and I can start a queue of comments, questions, any thoughts that folks have.
All right, so first question, but we don't have to take it in sequence. How would you describe the services your organization hopes to provide to Washington County? And I guess underneath all of these questions is, yes, what services, but what problems or impediments might you see along the way that you would want the county to answer? And are there any raised hands, Ty? Because if not, what does your organization need to be successful in making your application? Those are the first couple of questions.
I'm happy to go first.
Oh, thank you. Thank you.
Looking for a volunteer. I'm Bridget Kelfie with Home Plate Youth Services. So the services we provide now, we provide youth ages 12 to 24 who are experiencing houselessness. Street outreach, drop-in centers, and youth employment are our three main services. We also provide scholarships for trade school and community college, just anything to get back to stability. So there was like a nuance in your question, like what do we provide and what do we hope to provide? I think we you know, what I would add to that is just like more capacity for the housing piece of just like our outreach workers kind of do this, but there's just a lot more support needed. Like one of our youth rent just went up, so like our retention team could have like really helped prevent that or work to help them navigate that. So that's what I would add is more on the housing side of it. And I think just the capacity building, the infrastructure, things like that are related to like what we would need to support to grow. We've been growing. We're kind of the only service for street outreach and drop-in centers for youth in the county. But we hope to grow to meet the growing need. So,
Bridget, I have a question for you, even though I'm facilitating. Someone had asked me to ask this question today, and you might know the answer. They were asking me about the foster care population and the kids who age out of foster care. What happens to them? And you said you're in an 18 to 24 population. So do you deal with that cadre of youth? And is there something special for them?
Yes, we definitely see youth who have experience in the foster care system and as well of young adults who are graduating out of that. There are some, there's not very much. There's a few small programs. I'm blanking on the name, Taya, I forget what that stands for. There's a few small programs that support youth that are kind of the 18, have just aged out of the foster care system. There's a great need for more support. Definitely youth who have kind of fallen through the cracks. Yeah, for sure. So yeah, that's good to bring into the conversation.
Thank you. And I'm glad, I know the county people chronicled that, so we'll make sure we get some answers. So thank you. Thank you.
Yeah, of course.
Who is next? Lois O'Halloran? Yes. You're on mute, Lois.
Wow, I said the best I ever said, and I was on mute.
Oh, man.
I'm with Family Promise of Beaverton, and there are 3 Family Promises in Washington County. We are in Beaverton. We've been open for almost 3 years. We take children and their families suffering homelessness. We bring them into our program. Pre-COVID, we would bring them in with our church partners. They would stay with our church partners overnight. During the day, they would come back to the day center. They would work with our case managers and work on the issues that cause them to become homeless. And then we get them into independent housing. The help, there's a couple of areas we need help in. It's very, very difficult when people call and we can't take them in. So if they're in an active DV situation, it's very difficult for us to take them in because of our volunteers, and we don't have a way to keep them safe. So providing bigger and better services in the county, oftentimes when we call the DV organizations, they're full. And so having more DV services in the county would be really helpful. The biggest issue we have is because of COVID, we have our families in hotels right now. I think our organization, our volunteer organization, and our 13 host sites that host our families are going to be very, very slow to come back. And I believe that they'll be much slower than most organizations to come back and be willing to house our families. So we need some kind of permanent place. Right now, we have some grants to help pay for the hotel rooms, but very quickly those grants will disappear. And then, we don't really have a place to put our families. So we need some kind of permanent place that we can use to really launch our families into successful housing.
And one question about the host sites. Are they slow to come back because of COVID protocols or all the safety or the cost of the PPE and things like that, or is it something else?
So the majority of our volunteers, about 80% of our volunteers are 60 to 80 years old. And so it's for safety reasons. And you know, they're laying, I mean, you know, we have cots that we move, and we move the cots pre-COVID, we moved them every Sunday. And so they share the church's spaces. And so it's for the churches, for them, it's still very, very risky. They're not even able to fill their sanctuaries with enough people yet. So, you know, we're pretty far down the line.
Thank you. Thank you.
All right, Marcus, we have a question in the chat I'd like to direct to Joshua Kreitz, if you could help with this question. When will capacity building funds be distributed, and what will the process for that be? And will there be an application?
Yeah, thank you so much. That's a really, really good question. So we're working through those aspects right now. And, you know, how do we want to do it regionally? Do we want to do it at the county level? And how do we partner with our tri-county jurisdictional partners to look at that? So we are working through that right now, but we're excited to kind of get something stood up here very soon, because we know a lot of our organizations here in the county and organizations who want to work in the county are going to have that need to really build up that capacity, the systems, the technical assistance, the training, staffing, technology, all that good stuff. So we're working on that really hard right now, and hopefully we'll have something really soon to share on that. Thanks.
I have a question for the county, if there's no current questions right now, and that is the applications. Do people have to be 501c3s? Do they have to be a for-profit business? Can they be an informal church-related group? I mean, what are the criteria ultimately going to be for applying for these opportunities?
Yeah, thanks, Marcus. I think Jess, when she was talking about at the beginning, I kind of like the way she phrased it, which is we're trying to just have this really open process that will allow organizations to qualify. So we want all organizations to take the opportunity to apply and get through the door, and you know, just get qualified to become a service provider. So I'll touch base with Jess right now, but I haven't heard about any limitations on that. I think we want to welcome, you know, as many organizations as possible into the tent to do this important work. And a lot of these organizations are already doing that work. So thanks for the question.
And the reason I ask that, I know of a couple of groups in Washington County that are not affiliated with anybody, but they do work for their community. I can think of one, the Somali Empowerment Circle. They do work for their community. And even if they need to say, well, we still want you to have a fiscal sponsor, can the county share that information early? So if they need to align themselves with a fiscal sponsor, they could go through that process too. That's the only reason. I just wanted no surprises for folks.
And Marcus, I did want to draw attention for folks to the third question as well. What support will your organization need to be successful as a service provider in Washington County? Because I think as folks are thinking about what services they provide and what they would like to provide, this question is really connected to that as well. So what else do you need to be successful?
And thank you, Hyla. And would the county then help them build up the capacity to do what they identify as an additional need, or would the county do matchmaking and try to get them to work with another provider that provides that type of service?
Yeah, I think the goal will be, again, to get as many organizations under kind of this umbrella, and the approach will probably be both. And so if some organizations, let's say that you're working with a specific population and you're just working on maybe food insecurity, but you would like to do housing outreach and navigation, well, let us see if we can help build out the capacity for you to do that, the technical assistance and the training. Or maybe if your organization says, well, actually, we would like to have that, but we'd like to partner. Well, how can we help create those partnerships with another organization who's coming in and doing that? So I think the answer is like both.
Good, thank you. And before the next comment, I would just encourage, I know sometimes it can be daunting to speak in a public forum, but for anybody who generally has a quieter voice, but still has a question, please, I just encourage you to lift up your question. This is a very forgiving group. I know many of the faces on here, so I will say that. Oh, there is a raised hand, Ty.
Yeah, so we have Sarah Mole next.
Oh, yeah. So I have a little bit of feedback for the county in terms of what support we need to be successful as a service provider. The Unistar has a lot of reimbursement contracts with the county. And I think that for small culturally specific organizations, it's really important that the county be both flexible and prompt in paying those service contracts. And that's something we've had a little bit of trouble with. So just wanted to give that feedback.
Great, thank you. And we have a few comments I'd like to read out loud for folks that were in the chat. Feel free also if you'd like to unmute and tell us these, but I'm going to go ahead and read them. So from Rose Money, we have prevention services are in hot demand now, and as we look toward the future, the current pipeline of funding should be open up to other agencies to help meet the needs in the community.
That's great, and we're hoping that organizations here will will apply and say, hey, that's what we want to do. That's one of the categories. Absolutely.
All right, and the other comment from Juliana Scipio, sorry, has the county given thought into providing a county housing structure that would provide long-term housing for the houses, such as tiny homes, multifamily buildings that are county owned?
Yeah, thank you. These are such good questions. Yeah, I think it'll be kind of a combination of the county maybe owning some stuff. So there's, for example, a hotel that we purchased, the Lower Quality Inn, that's going to be 54 units of permanent supportive housing. It'll be the largest PSH project in Washington County, I believe. But then we also know there's other developers, nonprofit partners, other smaller organizations who might want to do development, or they might have a different type of project in mind, or private market landlords who want to house folks. So I know in year one, our goal is to create 500 new units of permanent supportive housing. And that doesn't necessarily mean real estate development, but it could be, rental assistance, like a voucher. It could be saying, hey, you're bringing on a Metro bond project with 50 units. How would you like to put 20 of those into the SHS measure, and we'll pay the subsidy for it? So we're really excited to be able to just add significant housing capacity in year one, because that's how we're going to get to this. That and all of the great services that are going to be provided and connections and wraparounds by the organizations that are here today.
Thank you, Josh. And one facet of Juliana's question I would ask you all to key on is the multifamily aspect of it, just because in communities of color particularly, and that's one of the bullets that you all have put as your focus, multi-generational multifamily homes, our communities generally need more space rather than less space. So any formula that you put together, hopefully will have a good dollop of multifamily options as well. So.
And Josh, thank you for that. And also, I'd just like to make another statement. And this is, I'm speaking from a personal, that I know someone personal, like my family members. The one problem that I see, especially in Washington County, the resources are very limited. I've had family members who was homeless, and they would go like from a day resource, and then there was nothing available for night resources. And then the other thing is even once they became unhomeless and now they're in rent that they really can't afford month to month, they just cannot afford it. And so trying to get on the affordable housing, like the Unistar, I know like the Unistar got this new project being built, the Marianne, and you can't find any information on it, like how to get on the list or anything. So, and we've called and we've actually gone down, and it's like, no, you can't contact anyone. So we're trying to find, I know, and they say you have to go downtown, but then they say everything is closed, all the lists are closed. So what do you do? What does a person do? You know, if they, and they may not seem homeless because they're not on the street, but they're sleeping on people's couches.
No, that's a great point, a great question. So I'm really hoping that through this measure, the immense amount of scaling up on longer term housing options will hopefully kind of bring more resources to bear, because you spoke to kind of a couple different situations there, which is really interesting and telling, which is some folks just need that access to a long-term affordable rent, place to rent, and whether that's rental assistance that they can use in the private market, or an apartment that has affordable rent, or maybe it's those short-term situations that come around where somebody just needs help for 6 months, 9 months, 1 year. And like I said, our hope is that 3 years from now, we've created 1,700 new almost vouchers. We're calling them rental subsidies, but really 1,700 new long-term rental assistance vouchers that are deeply affordable, and that we're creating thousands of other shorter-term kind of helping folks from falling into houselessness, or just those short-term rental assistance that could help for like 3 to 6 to 9 months. So really just hoping to get as many new housing resources that, like you said, in Washington County haven't existed. There's just not a ton of resources out there. So we're really hopeful and excited to bring these resources to bear in the upcoming months.
Thank you, Josh.
Can I say, just add one more thing? So Family Promise of Tualatin Valley, during the COVID crises, we did pivot our programming a bit, and we started housing adult-only households in a motel shelter model. And most of our adult-only households are folks that are ages 70 and older. Our oldest person was 84. And so many folks that had been living in their cars for a number of years, folks that identified as chronically homeless, folks in tent cities, just built up seniors, and one of their biggest barriers is just having access to technology, understanding technology, and there are some resources out there for those folks we're working with now, but without the assistance of having someone sit down with them and go through, there's a huge burden of paperwork required to access resources. And we've just found great success in just having that dedicated caseworker to help folks navigate all of that, to help them rehouse into sustainable housing. So that would be, I think that's a big need. There's a lot of older folks out there that just need that, that additional help.
Thank you. Thank you for that comment.
I wanted to circle back around to Sarah's earlier comment about county being flexible around funding, specifically for CBOs, community-based organizations, and being prompt. And wanted to see if there's any more specifics you would like to talk about that, so that we can add more detail in terms of the notes, and even try to incorporate some of this feedback in this RFPQ process.
Yeah, I can give you a little bit more just from Deanna Starr's experience. We have currently like 4 or 5 fee-for-service contracts with the county. Our accounting department is not large. We're a really small organization. So pulling together dozens of documents for a single reimbursement of like $1,500 is really a burden for us. We've had contracts, invoices go unpaid for several months because of a question of like $200 or $300. So it's been a little bit of a challenge. Fortunately, right now we're in a position where we can front these costs, but that's not the case for every organization, especially not smaller organizations. So yeah, those are our main concerns. And also with this kind of work, we've been asked to front things like security deposits for clients, application fees. And so we just, not every organization is going to be able to do that. And for those that are, we need like reassurance up front in the contract that that will be reimbursed.
And that's only going to get worse as you scale up with the what's coming our way with the end of the eviction moratorium. So, and I've heard that from not just Nathan at Vienna Star and Sarah, but from several smaller, culturally specific, as it turns out, providers in Washington County. So maybe there's a way that the whole county can look at their payment structures or set up something. And I didn't know about the security deposit piece, but that seems of concern because those add up quickly and those are a significant amount. So, but thank you for raising that, Sarah. Thanks for going back to the question, Ty. Oh, Lois.
Just to add to that, we have struggled with that as well. And we've struggled with having a different person have a different focus and kicking back things for, under $10 because we used the point hundreds versus point tens and then each time I can see Sarah shaking her head, she knows what I'm talking about. And then each time you get a different person looking at the receipts or going over them, then they have a different issue. And whatever it is went through fine the last 2 times, but now we have a new person looking at it and, they're pulling something else out. And again, it's under $100 that we're talking about, but it stops your whole thousands of dollars of payments. And, we've been really, really lucky to be able to front it, but, it's tricky and we have to be very careful. So that's a big issue for us, and I know it is for others as well.
Thank you, ladies. Thank you. Well, anybody with any burning questions, lift them up now because I know they're going to zap us back into the group in a moment. And I think the reason for that, they wanted to make sure that there was 10 or 15 minutes on the back end that we could hear out from everybody. But please remember, this is not the only opportunity. I think county staff can maybe put their contact information in the chat when we go back to the main room. But if you have further comments, if your comments did not get addressed, if you have follow-up questions, the county staff is willing and able to get you those answers. So please take the opportunity. They work for you. They work for all of us in Washington County. So man, put them to work. I didn't see the county people smile when I said that, but that's all right. They'll be all right. Oh, thank you for the supportive housing services contact. Thank you, Ty. And when people come back, do they just get flipped? Everybody just comes back all at once, or it's automatic? Or normally there was a countdown, but
yeah, so we must be close.
Okay.
Yeah, we're about 1 minute out. I did send a notice to the breakout room that they'd be joining us in about a minute.
Okay.
And I was just going to, if you don't mind, Marcus, I was going to bring up that in the session earlier this week, folks did mention some other barriers to completing, RFPQs and request for proposal applications. And I just wanted to make sure in this last minute that folks didn't have any more feedback on this area, like, what we might be able to do to reduce some of those barriers, or what you see as a barrier to being able to complete that application.
Do you recall some of the specific areas they lifted up?
We have heard requests through our survey collection, some early comments about the need for supportive technology, computers, software. Those are some of the early comments. I know that we also have heard comments just about some of the insurance requirements of working with the county, and that possibly being a barrier for smaller organizations that may not provide as high of a risk or a direct risk. So yeah, those are a few things that came up through our survey process.
Thank you. Thanks for raising that, Highland. Now, I can't believe there's this many providers and there's no more problems you all have to lift up. This is uncanny to me.
Hey, this is Ryan, and I'm with Related Northwest. I was trying to figure out how to raise my hand, but I couldn't do it, so I'm just going to talk anyways. And I think, Joshua, my capacity on this call is a little bit different, as I'm not a direct service provider, but we're an affordable housing developer. And Joshua, I think you touched on it earlier, but I think I just wanted to double underline the conduit for connecting providers with the developers. I mean, a lot of our success relies on our relationships with the service providers as well. So it'd be great in conjunction with all of this work that's happening to make sure that there's great connectivity opportunities to get people, to help work on partnerships and to bridge that gap.
That's great. Thanks so much. It's a really good point.
Does the county partner with low income and supportive housing developers there to co-produce projects in the county?
Yeah, I think the Metro Bond has been such an interesting project. 10 developments have been funded with through the housing department, through the Metro Bond. We've partnered with a couple different agencies or co-developed, but we've also just been a direct funder with the Metro Bond grant into nonprofits and for-profit developers to do affordable housing the last couple of years here. I think 800 units have been funded so far.
Good. That's a start. Thank you.
So Marcus, it looks like we're all back together, and we have about 12 minutes left in our agenda, and we may need only just a few minutes for wrap up, but if there's a chance for folks to share across the two different breakout groups, we'd encourage that too.
Well, the one thing in your breakout group, your facilitator didn't identify a report out person. So, I would ask the other group to maybe have your report out person report out. And in the meantime, someone from our group will step up and report out the discussion we had, if that's all right. So who was the facilitator of the other group?
That was me.
Yeah, good.
However, is Allie here, who was our note taker and reporter outer? Great, thanks.
So our group had some really candid and honest conversations around the organizations expressed not having enough personnel and a need to hire and train, that they needed the funding to be open and broad enough so that it doesn't mandate non-traditional organizations to fit into the same box. County, keep in mind, even though we may not have knowledge of how the system works, the county needs to be open enough to look at different ways of doing business. They're looking for a well-developed scoring rubric that the county can play a role in helping organizations to fill out so that it isn't necessarily requiring traditional experiences that may have served as barriers. IDEA was posted to maybe consider the score on racial equity in the county as not being very well, and that the scoring is tethered to the current system, and so to reevaluate how we identify a scoring rubric. Now how much time I have. So okay if I take another minute?
Sure.
Okay. Folks had a really good conversation around some organizations having a tangible fear about not having space to expand, and fear around participating in the process to begin with. And so the recommendation was to state very clearly what the investment to culturally specific organizations is and what role the county might play in helping to develop and expand culturally specific services.
Good.
So yeah, it was a very, very good conversation. If anyone wants to jump in from that group, if I didn't adequately represent all the conversations that took place, please feel free to do so.
Yeah, I'd like to clarify, if you don't mind, just because I think this is a really important piece for most of the organizations in this part of the RFPQ process. I think that developing a rubric that's very clear, that can be sent out to any organization that may be considering being a part of the qualifying process, because this is a multi-step process. Each step is going to have to be really open, transparent, and very clear on what the county is looking for. So if you're a teacher, you set a standard so your students can meet it, right? You can't meet a standard if you're not sure on what that standard is. And so we're really hoping to hear some very clear and specific feedback regarding how that evaluation criteria for every part of the services that you're looking to be provided is going to be evaluated. If it is a scoring system, that's fine. If it is a 1 through 10 rubric, that's fine. Whatever it is, just making sure that that's really well developed down on paper and distributed in an open and transparent way, so we can really understand what services you're looking for. Thanks.
Thank you, Melody. And we'll take one more comment from that group. I see Sushmita is in the queue, so let us hear from Sushmita, and then we'll hear from our group.
Good afternoon, Marcus and everyone. So there were a couple of things that were also mentioned, Amber, and one of them is that in order for equity to be addressed, instead of asking community and cultural specific organizations to come to the county meets them where they are at. As in, when we know that we want a wide range of experiences, a wide range of community being addressed, they do not have, quote unquote, the sophistication that the county and the government requires for them to function within the parameters that are required. So how can the county hire RFPQ writers and have those organizations or people that want to provide services meet with them and get that process done so that there is no additional burden and all of those barriers can be erased? I don't know, my screen has frozen, so can everyone hear me? Okay, so that is one way of eliminating a huge barrier, because government contracts tend to be quite intimidating for most people. We know that there are language barriers. We know that people have pride barriers. A lot of communities of color are not comfortable dealing with government officials because in their home countries, working with government has had a lot of trauma. So how do we make government truly of the people, by the people, for the people, by ensuring that we are part of the community? And we also need community and community-based organization input in who's getting the contracts, and that people who are getting the contracts have diversity and decent wages so that they can ensure that the services from start to finish is equitable. And that's it.
Right, that's beautiful. Thank you very much, Sushmita. And now we're going to go back to group one, and we're going to hear from Highland, who was our note taker. But at the end of Highland's report out, please, anybody in our group, feel free to chime in for anything overlooked.
Yeah, I'll just be summarizing some of our notes. So if folks don't feel like I fully represented your thoughts and your feedback, please feel free to speak up and share as well. I think in our group, we heard a lot about the need for the county to be prompt with paying service contracts, both so that providers can work to focus on providing the services to the community rather than going back and having to repeat paperwork and repeat contract submissions. But also, so let's see, so that we can reduce barriers in the amount of paperwork. We can guarantee payment within a specific amount of time, so organizations know what to expect in terms of receiving payment. So there was a lot said about contracts with the county. There was also some commenting on just reducing barriers in being able to provide technology and software for filling out paperwork that needs to be sent to the county, or even providing that technology to clients to use who may not have access to it. And it seems like there were also some comments around just needing more staff capacity. Some of that was echoed in the second breakout room, but more staff to be able to provide more services, to help clients with their own paperwork, to help them navigate some of these complex systems for receiving resources and services would be really helpful. And then Marcus, you actually brought up a good point about, when affordable housing is offered, keeping in mind that some communities of color are multifamily, multi-generational, and need more space rather than less space. So maybe more of the larger units rather than the smaller, more studio-like units. And then some folks talked about opening up the pipeline of funding to additional agencies to just serve the greater needs of the community, and being flexible with that funding. So I think that's what I took away from it. But like Marcus said, please feel free to speak up and add to what I've noted.
Lois?
So we added that we needed more resources for DV, and we needed resources for temporary housing, since our motel model would likely go away when the grants go away. So that's pretty important for us.
And just overall, I mean, I can assure you that any question that was elevated, the county wrote it down. The county gave some real-time answers, but anything they couldn't answer or didn't answer fully, they will post, I believe that's correct, post to the Supportive Housing Services website that discusses this RFPQ process. And they have encouraged you all to continue to send in lots and lots of questions, whether it's about the process, or the amount of funding, or the availability, anything you can come up with, and they will try to respond accordingly.
And then I know we're wrapping on time, but I would like to see if Josh or Jess have any final thoughts before we wrap up.
Just gratitude, so much thoughtful feedback that really helps us think not just about this RFPQ process, but also about moving into these partnerships with you contractually, but then also through the service provision we're going to need to do with you in full partnership throughout the life of this program. So there's a lot of work ahead for us, and we're so grateful we get to do this work with many of you and your colleagues and your organization's guided by the missions to do this work in partnership with us. So thank you. It's a long thank you. Yes, Marcus, I see your comment in the chat. I think there is a survey link coming, and if it will be there by the time I'm done talking. So there is a tool that we've created, just a simple, maybe 20-minute survey where you can go in and check the boxes of the services you currently provide, the services you would like to provide, some of the challenges you experience in providing those services, the needs for supports and training and capacity that you will have as future service providers. It's a lovely little way to say, to put down on paper much that you shared with us today. So if you have time, we would really welcome your response to that survey. It will be open through next Wednesday, so you have some time to get to it. And I'll stop talking, pass it to Josh, and I'll go find that survey.
Thanks, Jess. I'll just be short. I just want to thank everyone for their time. We keep saying over and over again, this is a historic measure, a historic opportunity to address houselessness, but it's also a historic opportunity to get it right. And by get it right, I mean really, really focus on the way that we house the individuals in our community, our houses, the way that we work with our community-based organizations and culturally specific organizations. And just from the very start, and the RFPQ and the way we contract, that's a good way to get it right, that going out the door. So we're going to continue to work with you. We're going to continue to partner with you and learn together. And we're just really excited for this. So I'm not sure, Marcus, if there's anything else you want to hit on.
I did. I just had one question, and that was, in some of my conversations over the last month with the county, I understood, but maybe I got it wrong, but there's a bunch of county people here that can tell me, even though this is the supportive housing services process and project we're talking about right now, the county is looking to work with community on just about every other area that the community and the county would come together on. And there may be future opportunities, not just in housing related services, but in other services that the county offers, maybe in healthcare contracting, maybe in safety contracting, whatever the county's purview is. I thought I heard that in conversation, but I wanted to verify that with the county. So for people whose agencies do more than just this, they might know that there's something coming down the pike.
I'm gonna check to see if Latricia could respond a little bit to that, and just thinking about what the long-term plan is for Washington County and its engagement.
Absolutely. You caught me just as I was about to sneak off to open up another Zoom for an interview for our equity policy manager position. But I will say that one of the great areas of alignment is the opportunity to bring the community engagement role for supportive housing services and the equity senior program coordinator role for housing under the umbrella of the Office of Equity, Inclusion, and Community Engagement, so that the lessons we are learning from the supportive housing services opportunity we can apply countywide in our work related to implementation, full implementation of civil rights, looking at our data, making sure we're using best practice standards for disaggregating our data to understand where inequities are, increasing our supplier diversity, and looking at workforce development strategies related to having a diverse and highly competent workforce in multiple areas where we see Black, Indigenous, Latinx, immigrants, and refugees underrepresented in our workforce across multiple disciplines, and the use of the equity policy review lens and process in the ways that we analyze policy, develop program, and improve our procedures. So yes, this is one very issue-specific, discipline-specific area of equity and community engagement work. And the Office of Equity, Inclusion, and Community Engagement is staffing up as we speak to expand those learnings countywide. And I do want to just say that this is under the direction of the County Board of Commissioners and with the leadership of the Chair, Catherine Harrington, and the other members of the board who unanimously adopted the equity resolution. So equity being at the center of all of our county work is a priority for the board.
Thank you. Thank you very much for that. So I wasn't totally wrong. Yay. But well, that is all that I have. I wanted to just personally thank everybody for coming out today. I apologize. We went a few minutes over, but thank you all for hanging in, those who did. And I will toss it back to Ty for the very last word, but thank you again, and continue to keep your questions coming to the county staff, please. Ty?
And I see one last hand, and I know everyone is ready to roll out, but I do want to just respect that we have one more hand raised. So if you go to Sushmita.
Sushmita, hi Ty.
Excuse me.
I'm so sorry. Please, you can have the last word, but before you have the last word, I know the county wants to work with equity. We talk about equity, but I'm very sorry it is not happening. It is not visible, at least not at the community end of things. We have hired economic development director without taking input from small businesses. We are not even included on the table in any decision making. So, and when we spoke about body cameras, community stepped up, gave the information, but again, decisions are made differently. So we need greater transparency. Yes, we want to work with equity, but without transparency in decision making and true inclusion with each impacted community, equity demands extra effort. So we have to put in that extra effort and timeliness. I'm the Land Use and Planning Commissioner for a county. Upon asking for a land acknowledgement way back in January, we are now in March. We are still debating about it. And how long can equity wait? We have to start addressing that issue as well. How long do we wait for changes when our communities are impacted and suffering right now, and when they feel that they're not being heard? When we can do things easier, faster, better, we need to do that. Thank you.
Thank you everyone for joining us today and for fully participating in this meeting. This meeting was recorded, and I am going to work with my team to figure out how we can share this meeting out with folks. We will be sharing the PowerPoint and also the documents, links, handouts, surveys in a follow-up email that should be going out either late afternoon today or early Monday morning. So you can forward that on to your colleagues, anyone who wasn't able to attend. Thanks again for this partnership with the Coalition of Communities of Color, the Office of Equity, Inclusion, and Community Engagement, and Supportive Housing Services for coming together to do these presentations and also collaboration. Thanks all, and I think we're gonna wrap up and end the meeting.
Thanks.